Albertans expect to have access to the best healthcare services in Canada. We know that we have enormous capability in Alberta. We have very knowledgeable staff, we have a stable funding agreement, we have great opportunities to improve the way we deliver services. As healthcare professionals, you expect that you deliver the best healthcare services that you possibly can. We need to support you in doing that. The changes that we're looking at today will enable us to do better and enable you to have a better contribution, a bigger contribution to health service delivery in Alberta. We have 7 changes that we're planning to undertake that will change the face of Alberta Health Services and produce an organization that is focused on the front line and is focused on delivering better health services day in and day out. I should point out that although there are 7 different items I'm going to talk to you about, they are all interrelated. They all must be done in order for Alberta Health Services to improve its performance. The first of the 7 items I want to talk about is the creation of a new role, the Chief Operating Officer role. It brings together all of the community services, the continuing care services, and the acute care and public health services that Alberta Health Services offers into one operating unit. In the Chief Operating Officer's portfolio, there will be a structure of 5 zones. The zones will become our key operating units, and they will integrate all of the activities that we provide in a particular area. Acute care, continuing care, everything that you think about in terms of Alberta Health Services delivery will be concentrated in these zones. Each zone will have a leader, and that zone lead will have accountability for community services and for the hospital services within that area. The Chief Medical Officer will work very closely with the Chief Operating Officer. It's important that we have a strong emphasis on quality and safety. The Chief Medical Officer will bring that to bear, but also look after the medical staff issues that are required to keep the zones working effectively. In order to offer the best healthcare services we can, we must integrate physician leaders into our operational decision-making. In order to do that, we need to create physician leadership roles that are linked to zone leads, to hospital leads, and throughout the rest of the organization. By having physicians linked to our organization in this way, we will be able to deliver the best health services possible in Alberta. In the current situation in Alberta Health Services, we have operational strategies spread across several portfolios. In the new organizational model, we'll try and bring together all of the operational strategy into one portfolio. So whether we're looking at things like mental health or seniors care or public health, it comes together in one portfolio that can plan effectively for the future. One of the things I've heard in speaking to staff across the organization is that although we're very people-focused, we don't have representation of our people at the executive level. For that reason, I've created a new portfolio called People and Partners, which brings together many of the human resources and professional practice types of issues into one portfolio. Beyond that, it also looks at the relationships that we have with the communities. These changes will improve the operational effectiveness of Alberta Health Services. The focus on operations through having a Chief Operating Officer role will allow us to make much better, much faster decisions in terms of delivery of care every day. The focus on zones will allow us to meet the needs of communities much better than we have over the past 18 months or so. Sharpening our focus on people and strategy will allow us to make better decisions and allow us to move forward more effectively. Looking forward, we have some exciting work over the next number of months. We have a new organizational model to bring into play. We have exciting design work around the new roles and new functions for our zones. We have new opportunities in terms of how do we work with clinical networks. I'm looking forward to working on these goals with you. I need your support, and this, I think, is fundamentally important for people interested in health delivery in Alberta.